Hello everybody, my name is Dr. Vernaya and today we will start week 2, chapter 1, 3 and 5. This will be recorded in separate 15 minutes recordings lectures. Chapter 1 we will explore seeing older adults through the eyes of wellness. These objectives are objectives for the entire week, and it will cover chapter 1, 3 and 5 as I told. So we will explore and discuss the complexity of health care for older adults. We identify age-related changes, what are risk factors, and as a consequence, what are functional consequences. Since the first part of the class we primarily concentrate on functional health of elderly adults. Also we will compare and contrast different definitions of health and wellness and state of how the definitions are different from the older adult. We will explain and give examples of health promotional programs for those who are aged and discuss the concepts that underpin functional consequences theory later during presentations. We will differentiate between positive and negative functional consequences and what are positive and negative outcomes. We will explain the importance of assessing functional changes and changes in cognition of older adults. We will differentiate between different ages in older adults, such as young old, middle old, oldest old, what are frail, able elder, and centenarian. We will explore holistic perspective on aging and wellness. Take a look at these pictures. Aging in reality is a complex process. It includes both losses and gains. If, for example, you will go to a park before Corona era, you might see many elderly individuals who are doing exercises, physically active. If you go even further to the Venice Beach, you may see some elderly people who will rollerblade or take a bike, right? But working in a healthcare setting, and primarily you may see older adults who look like on your right. And it was my interesting experience that once I came to see my patient in Rehoboth, Beverly Hills, and while I was changing from street to nursing clothes, one nurse who does admission, she said, "Marina, can you explain why your patients are so sick?" And I started thinking, why my patients look like this to the right, not like to the left? And the answer was on the surface. They came from the country, from Russia, where health system was not perfect. These people were smokers. They didn't watch their diet, and inavailability of prepared healthcare system makes them sick with more chronic conditions that are not very well controlled, and as a result, they became more sick and fragile as they aged. So some of them look like this. So I'm not stereotyping, it's the population that I'm most exposed. In relationship between aging and wellness, description of successful aging. What is successful aging? First of all, it's engagement in active life. So this individual will feel needed, active, not passive, and during the day, doing groceries, cooking, watching grandchildren, so being active, having high cognitive and physical health and function, so no significant memory loss and no psychological issues. Low probability of disease and disability. The more the healthier the adult, the less probability of diseases and disability. And in case if this older adult gets sick, he or she still has resources to overcome the disease and return back to his or her functional status sooner than the one who is more fragile. Aging in reality is a universal process, and it begins from the birth. It doesn't start at 65 years old. And we will discuss today the difference between subjective, perceived, chronologic, and functional age. So what is the difference? Subjective age is what the person feels about him or herself, how young you feel. A person at the age of 24 might feel much older, about 40s, but the one who is in his or her 70s and going to the beach for physical exercise every day might feel much younger. Perceived age, we also will discuss it later, a little bit. Next slide. It's how other people estimate your age, how you're seen in eyes of others. Chronologic age is the length of time that passed since your birth. And based on chronologic age, you might have certain privileges, such as when you were at high school, you obtained permission to get a pink slip and to have your driving test. At age 18, you might become eligible for voting and getting married. Once you're 65 or 67, you will be eligible for retirement. Functional age is a little bit different. It's about your psychological health, psychological well-being, how active the person and what he or she can do to participate, for example, in activity, to do self-care, and etc. In regards of perceived age, take a look at this picture. I'm pretty sure that you saw this guy when he was alive on the media. I think he passed away in the age of 18 years old, and he had a condition called progeria. This is a genetic disorder, and it's pretty rare. As you can see, at the age, or as a teenager, he looked old. So, perceived age, he looked old, but in reality, he was young. This is an example of perceived age. Age groups and the relationship between aging and wellness. I try to go deeper and look for different age group to give you specific numbers, but what I faced, I realized that different resources have different numbers for age groups. I really decided not to overload you with these numbers like you have in pediatric, different age group. But here you're supposed to know that according to chronologic age, elderly people divided under young old, middle old, and oldest old. There are also septenarians, and these are individuals who are 100 years old or older. I had a couple of patients who were over 100. In terms of functional age, also keep in mind that this is a contribution of an individual to the society and experience of personal life. High level of wellness depends on physical condition, possibility to keep balance between health and wellness, and being able to self-care in the environment. I will not ask you to memorize all these numbers, just would like to show you few interesting data here. All of you have already taken EVP class. So take a look at 1600s. Median age was less than 16 years old. Median from EVP class, what it means? It means the middle. So maximum age in 1600 was 32 years old. People died, the longest longevity of life was 16 years old. People died in this age. Scary, right? That's why in 1700s and 1800s it was gerontophobia was very popular, and people were scared of those who are old and sick and tried to idolize those who are young. Only in mid-1950s, professional organizations became more interested and engaging in patients who are old. But only till millennium, gradual movement toward a more positive imaging of aging happened. So you can see the whole history, how long it took for the society to accept elderly people positively. So what is ageism? Already the end of the word shows us that this is a prejudice of old people. How frequently see we ageism in healthcare setting, in real life? Let's see. This picture, during traditional class on campus, when I show students this picture, I like to observe their reaction. Sometimes they laugh. Sometimes I see disappointment in their faces. So is this picture look humorous or offensive? The person who has a problem with the memory, or those who might accept this picture as offensive, because at every few feet this picture shows that you have to remind the person over and over again. In healthcare setting, especially at nursing home, it can be an issue because you have to rearrange patient very frequently, but the one who is functional and in good health might take this picture offensive. So the issues might be too serious to make fun of it. Societal attitude toward aging ranged from respect to fear. Gerontological nursing, we attempt to educate patients, caregivers, family members about long-standing negative attitude and approach that needs to be taken to meet the needs of this population. And we can see ageism on job market, medical care, nursing home, and media. On job market, the older the person, he or she might face issues to find a good job in comparison to a younger one. Those who in 50s or 60s especially, it might be an issue. Medical care. Those who are old, let's say, and have a poor prognosis. For example, if my patient stops eating, forgets how to swallow, a question about G-tube placements is erased. So when I talk to my supervising physician, the first question he asked me if I spoke with the family about how aggressive the family wants to be. So we need to explain all positive and negative consequences of G-tube feeding, and decision has to be made. So this taking into consideration. In regards of nursing home, it might be underreported elder abuse or neglect. However, in my practice, I would see only maybe a couple of times. And finally, media stereotyping. When you guys sit in class, I like to see, to observe your clothes, what you wear. None of you wears usually a cardigan or a t-shirt with a picture of a person who is old. Usually we also try to dress in what will support youth and beauty, right? What is aging anxiety and age attribution? Aging anxiety is when a person might experience worries and fears about getting old. Not necessarily about personal experience of getting old, but even to visit their parents or grandparents. I have a relative who never visited his mom when she became very old. And he tried to stay away from hospital as much as possible. This is an example of aging anxiety. And age attribution is even more serious in my opinion, because when a healthcare provider starts attributing health-related problems to age, it's serious, it's dangerous. If a person comes to a doctor with a knee pain, and the doctor starts telling about age, not examining the condition and thinking on interventions, what to do, this can end up with immobility, pain, injuries, and you have to keep this in mind. So delayed treatment might exacerbate the condition and increase even the risk of mortality. This concludes the 15 minutes of chapter 1, and the second part of chapter 1 is coming.